Hello, I am Soumya Darshi. I'm a first year student in Ferguson College, Pune, studying psych, and me and Nanika are going to teach obsessive compulsive and related disorders for the next few classes. Nanika, please introduce yourself too.
Hello everyone. So I am Nanika. I am also a first year student from Christ University, Delhi NCR. Yeah. And I am also pursuing a dual major, psychology and English.
Let's start with a disclaimer first. DSM-5TR is a clinical tool intended to be used only by trained professionals. It should not be used for self-diagnosis or to assess others without proper qualification. Misuse can lead to misunderstanding and harm. Always consult a licensed mental health professional for accurate diagnosis and support. Basically, it's a clinical tool. Please don't use it without proper training and supervision. We're not qualified to use it, even if you're studying it right now. And if you feel like any symptoms sound relatable or sound familiar, please go consult a licensed professional, a trained professional. Don't self-diagnose and do not diagnose others without proper training. So, what are obsessive compulsive and related disorders? These are mental health conditions that involve obsessions and compulsions. Obsessions like repeated intrusive thoughts or urges that cause distress. And compulsions are repeated actions or mental acts that a person feels like they have to do to reduce anxiety. Think of it as a stuck record on a turntable. Um, have you seen those record players? Maybe that's broken, so the record keeps repeating the same line. That is an obsession. Your mind keeps repeating the same thought. And to release that, to stop that for even momentarily, you have to pick up the needle and put it down, which is a compulsion. Okay? So people feel driven to do these behaviors to reduce anxiety or prevent something bad from happening. Even if it does not make any logical sense, they feel like they have to do that compulsive action in order to prevent something bad from happening or reduce anxiety. Like if I do not count to three every time I open a door, something bad will happen. That could be a belief that I have, and like an obsession that I have to count to three whenever I open a door. That will lead to that compulsion of counting to three every time I open a door, in order to not like have more anxiety or prevent something bad from happening. Main types of obsessive compulsive and related disorders are obsessive compulsive disorder, of course, body dysmorphic disorder, excoriation skin picking disorder, or and trichotillomania, which is a hair pulling disorder, and hoarding disorders will be covered in for like the next classes. Other types of disorders include substance or medication induced due to another medical condition, specified and unspecified disorders. These also will be covering in next classes. What makes these disorders different from everyday behavior? Their intensity and impact. These behaviors go beyond normal habits and cause significant distress and interfere with daily life. Think of it as a fire alarm. Until you do that action, a fire alarm is going on, blaring in your head. So you have to do that action. But regular habits are more casual. You maybe I have a habit like a to-do list. Think of it like a to-do list. I have a habit of drinking water in the morning. That's a to-do list. But if I wake up and I don't drink my water, it's not gonna affect me that much as much as somebody with an obsession with having water first thing in the morning would. For them, a fire alarm is going on in their head. They are having the repeated intrusive thoughts that you have to drink water first thing when you get out of bed. Okay. Second is awareness levels. Some people are very aware of their behaviors, like um, and some people are not aware of their behaviors. They do it automatically without really thinking. Think of it as an automatic car versus a manual car. Okay, sometimes you're fully aware and you know what you're doing, which is manual, and sometimes it's just happening without you noticing, which is automatic. Connections to anxiety. Some of these disorders are closely related to anxiety disorders because of the way anxiety triggers repetitive thoughts and actions. Anxiety is like, think of it as you have boiling water on the stove and you have like आपने उसको एक ढक्कन से ढक दिया है. So anxiety is the boiling water that is like creating steam and everything. And the dhakkan will of course tremble a little. So that is the OCD behavior. So the anxiety से जो pressure create हो रहा है उसको हटाने के लिए OCD behavior किया जाता है. So far, are there any questions? Okay, Ashi. Yeah.
Does it always like come with a bad that is something bad will happen with the thought of that? Like, does it happen as like normally also, or it always comes with the thought of something being going bad?
No, not always, but there is like a certain components like it won't reduce your anxiety, or it will if you don't do it, it's gonna bug you the entire day. And generally, in most cases, there's a belief that something bad will happen if I don't do this. That is why the obsession is there. Understood?
Yes, thank you.
Thank you so much.
So we'll talk about the diagnostic criteria for OCD. So according to the DSM, the DSM says that OCD is diagnosed when a person has obsessions or compulsions, or it can also come with both. Uh, दोनों एक साथ भी हो सकता है. Maybe the person is repeatedly thinking about something or is compelled to do something, or even both of them. Uh, these causes distress, these take your time, and these aren't due to any other condition or any other substance. So if we go into deep into obsessions, so obsessions are basically intrusive and unwanted thoughts or images or some urges that you don't really want. They are disturbing and they feel very, very wrong. Uh, it keeps coming back to your head, even when the person who is dealing with them, they try to ignore them, they try to even get rid of them, but just keep coming back. For example, if the person is thinking, what if मेरे हाथ are full of germs? What if मैंने वो गैस खुली छोड़ दी या फिर something like that? So these are thoughts. And the difference that from compulsion, it is that compulsions are repetitive actions. Obsessions are just thoughts, but compulsions are actions that you do or even mental rituals. They try to reduce the anxiety. For example, Abhi Soumya mentioned the connection to anxiety with OCD is that what you repeatedly think, that means obsession, it gives you an anxiety. And to reduce that anxiety, you are compelled to do those repetitive actions. Like these aren't done for fun. People do not like doing them. They are like a need. They are not a choice, but they're like a need. For example, you're washing your hands 20 times a day, or you are checking door locks again and again if it is locked, or something. To actually diagnose OCD, it should be time consuming. For example, दिन में 1 घंटे से ज़्यादा अगर कोई thought आपको बार बार आया जा रहा है, फिर you are doing um, you are cleaning your home and you are cleaning it repeatedly 1 घंटे से ज़्यादा और हर रोज, तो you should get it diagnosed. It should cause you distress and it should interfere with your daily life. For example, your school, your work, your college, anything. And it should not be due to any kind of drugs, alcohol, or any other disorder. So specifiers for OCD, specifiers are basically extra labels. They help you describe the type of OCD that a person has. For example, अगर treatment वगैरह के लिए you go or for understanding, so specifiers help you understand that the type of OCD a person has. An insight specifier is basically that how aware someone is of their OCD and their thoughts and behaviors. Like if you have a good insight, if you have a fair insight about it. So, for example, a person is thinking that my hands are dirty. Now, a person who has a good insight, they knows कि उनके जो beliefs हैं, they are not really true. Like उनको दिख रहा है कि उनके हाथ गंदे नहीं हैं. These are the people with good insight, and the people with poor insight, they think that their fears might be true. Like they are less convinced, but they are a little bit convinced that it can be OCD. And people with absent insight or maybe who are delusional, they think that they are wholly convinced. They do not have any doubt at all. They think that it is OCD. It is absolutely OCD. Without even diagnosing, they are just very sure that it is OCD. It matters because people who are delusional, who are absent, वो फिर हेल्प नहीं सीख करते हैं आसानी से, फिर थेरेपी उनके लिए हार्ड हो जाती है बिकॉज वो तो कन्विंस हो ही जाते हैं कि अच्छा ठीक है अब तो मेरे को ओसीडी है एंड इट कैन नॉट बी लाइक इट कैन नॉट बी क्योर्ड, ठीक नहीं हो पाएगा तो फिर अब क्या फायदा. तो फिर वो उस चीज को अपने दिमाग में बिठा। And tick related specifier is it is used if a person has a current or past history of a tick disorder. For example, Tourette. Now there was a movie that was made, History, I guess Rani Mukherjee सबने देखी होगी तो yeah, उस पे जो Tourette movie बनी थी, it was that she is having a current the main character is having a current disorder for Tourette. So it is a tick-related specifier, and OCD that are with tics, they often start younger, like when you are 10 years of old, 11 years. So yeah. Tick-related OCD are they are mostly common in males and they run in families. Mostly people they know that their OCD thoughts are irrational. जबकि others जो होते हैं वो उनको like बहुत deeply अपने मन में बिठा लेते हैं, वो मान ही जाते हैं. इट्स नॉट अबाउट कि कौन स्मार्ट है या फिर जिसको अक्ल नहीं है. इट्स अबाउट कि ओसीडी ट्रिक someone brain. If you are believing that it is, if you're strongly believing it कि अरे मेरे को OCD है, तो फिर that is how your OCD has tricked your brain. And if you think that it's irrational, then it is on a lower level. Next is diagnostic features. Next slide. Okay. So diagnostic features, this section is all about how OCD looks and it feels in real life. So again, we studied about obsessions and compulsions. That obsessions are thoughts, urges. That they are they pop into your mind repeatedly, repeatedly. They feel intrusive because they don't really belong there. The thoughts do not belong there, and they just cause you anxiety and distress. अब लोग तो इग्नोर करने की कोशिश करते हैं बट दे जस्ट कीप कमिंग बैक. फॉर एग्जांपल व्हाट इफ गाड़ी चलाते समय मैंने किसी को ठोक दिया, या फिर व्हाट इफ आई एक्सीडेंटली ऑफेंड गॉड, व्हाट इफ आई टच दिस, what if I touch this and then I get infected? So these are obsession thoughts that keep popping up in your mind repeatedly. Compulsions are repetitive behavior, हाथ धोना या फिर mental act, for example, praying. Now, you are repeatedly praying 10 times to prevent a car accident that is not even going to happen. You have thought it in your mind, you are obsessed with the thought that you are going to be there in a car accident today. And then you are praying 10 times a day, 20 times a day, just to prevent that fictional car accident, which is not even going to happen. So the key is that they're not connected in a realistic way. Compulsions don't really bring you pleasure. It's like they're just temporarily relief. It is a break from the anxiety because of its connection to anxiety. First, it is a loop. For if we study it like a loop, first the obsessive thought appears in your mind. It gives you anxiety. Then you find a way to break from it, a temporary relief, which is a compulsion, and then the loop restarts and it continues. So, like, imagine your brain is telling you a scary lie again and again and again, and you have to do a ritual to feel okay. So that is what OCD is. It is not about being neat or clean. It is about being anxious and not in control. So associated features are basically the OCD में commonly they are seen with people. Number first is avoidance. People often avoid things जो उनके ऑब्सेशन को ट्रिगर करता है. फॉर एग्जाम्पल सर ऑब्सेस्ड विद द थॉट कि तुमने डोर लॉक नहीं किया, तो जो बंदा है वो डोर नॉक टच ही नहीं करेगा. दे वोंट यूज पब्लिक रेस्टरूम, they will not read or watch news because they think that it can trigger their thoughts. Number second is feelings of disgust. The people who are actually suffering with OCD, they feel intense disgust. They do not just feel fear or they are not just fearful, they are intensely disgusted by their thoughts. Like it's not just I'll get sick. It is just that this is feeling very gross and this is feeling very, very wrong. Number third is sense of over responsibility. So people with OCD, they feel that it is their job to prevent harm even when it does not make any sense. For example, a person says कि अगर वो लॉक मैंने 10 बार नहीं चेक करा कि मैंने उसको लॉक किया या नहीं, तो कोई फिर आ जाएगा अंदर और फिर सारी गलती मेरी होगी. So it is over responsibility. Number four is guilt, shame, and your intrusive thoughts. OCD is not just about physical rituals. It can also include taboo thoughts, like thoughts of hurting someone, या फिर religious obsession. Now, people with OCD, they don't really want these thoughts. They are just ashamed of it. Like, मान लो, if you do not have the best relationship with someone, and there is a thought that अरे मेरे को तो इसको physically मारना है, So for that is a thought. You're not really acting on it, but you are very ashamed of having this thought. Ki, Arey, why am I even having this thought? So OCD can make people feel like they're in a horror movie that only they can see. Like बाहर से तो कुछ गलत नहीं लिखेगा, but अंदर से it feels very very terrifying, and they will do anything to stop it. So prevalences is basically tells us how common OCD is. Now, if we take example of America, it is around 1.2% of the adults have OCD. That's basically 1 in 83 people. So it's very common than we think. So gender differences in adults, OCD is slightly more common in females, and in children, it is more common in males. Uh, OCD does not always look obvious. Like अच्छा इसको है because ये like बार बार खुद के बाल सवेर रहा है या फिर बार बार ऐसे कर रहा है तो मे बी इसको OCD होगा. So it is not very very obvious. कोई अंदर से silently suffer कर रहा होगा. And but you never know. But knowing that 1 out of 83 people can have OCD, it helps you break the stigma. It helps awareing the crowd. Like you will treat everyone with the care. So OCD affects millions of people and mostly like बहुत लोगों को OCD होता है लेकिन आपको पता भी नहीं होगा किसको होगा वो कभी भी किसी को भी किसी भी एज पे हो सकता है. So this section it explains that OCD जब शुरू होता है तो over time how it changes and the whole journey जो लोगों को होती है how the journey is. So OCD starts with two main age windows. Like it can start in childhood, early teen, or even early adulthood. Uh, it is very rare for it to start after 35 of age, but anything can happen. So it begins suddenly or even gradually. Like suddenly in some cases, like कोई stress हुआ बहुत ज़्यादा आपने stress लिया या फिर कोई illness हो गई तो it can also begin suddenly or even gradually in others. Like बच्चों में for example किसी को सिर्फ anxiety है या फिर किसी को Tourette's की दिक्कत है तो फिर उनसे it can gradually build up in their body and the course over time. OCD can be chronic and it is some fluctuating also. Chronic is like it is long lasting. It is and fluctuating is like sometimes it is better and sometimes it is so worse that you cannot control it. So it is fluctuating. And some of them improve with treatment, but many of them had persistent symptoms of it. तो किड्स होते हैं अब उनको ओसीडी के बारे में नहीं पता होता तो दे माइट नॉट रिकॉग्नाइज कि उनके जो थॉट होते हैं उनके जो बिहेवियर होते हैं वो इरेशनल होते हैं लाइक वो बार बार हाथ धो रहे हैं एंड उनको फिर भी फील हो रहा है कि हाथ गंदे हैं एक वो देख सकते हैं बट फिर उनको नहीं पता ना कि दिस इज ओसीडी एंड एडल्ट जो है उनको तो रिकॉग्नाइज हो जाता है बट फिर भी दे फील पावरलेस because this is what OCD is. You are controlled by your mind. When you take stress, it makes it worse. Like कोई illness है, कोई exam है, कोई trauma है, जो भी है. If it is a life stress, it can intensify your OCD symptoms. So OCD can start early, like even बच्चों में भी, and usually it sticks around. If you get the right help, people can learn to manage it. It's not curable, but if you learn to manage it, and you can live with it. So इसमें कुछ reasons है जैसे कि why someone can develop OCD and उनके recovery chances, like what affects their recovery chances. So, first is genetic and family factors. Like OCD often runs in families. Like if it is a first degree relative, like आपके मम्मी को है, आपके पापा को है, फिर आपके भाई बहन को, it is a first degree relative. तो फिर जो आपका risk है कि आपको भी होगा, that is 2 times higher. And risk is even higher if their OCD started in childhood. अब for example आपकी मम्मा है, उनको बचपन से ही OCD है, ठीक है? तो फिर आपका रिस्क तो है ही, बट आपका रिस्क और भी ज्यादा है अगर आपकी मम्मा को बचपन से ही OCD है. So it is a biological vulnerability. Next is temperament. People, उनके mood के हिसाब से we see people who are anxious and people who are very very perfectionistic कि हर चीज it should be perfect. While we all know that perfectionism does not exist, but they are very perfectionistic and who are very very responsible and they are very very careful. So these type of people who have this type of temperament, they are more likely to develop OCD. These traits are not really bad, but OCD जो है इनको और ज्यादा enhance कर देता है which is distressing, which is coming between your life, which is interfering with your life. Next is environmental factors. Environmental factors can basically trauma, abuse, negative life events, and these can trigger or even worsen OCD. Like if you already have OCD, trauma, abuse, or the life events, like negative life events, it can worsen it. And infection इन्फेक्शन जैसे कि बच्चों में इन्फेक्शन होते हैं वो भी सडन लाइक ऑनसेट ऐसे शुरू हो सकता है कि अब देयर इज दिस इन्फेक्शन व्हिच इज कॉल्ड पैंडा. इट इज पीडियाट्रिक autoimmune neuropsychiatric disorders which are yeah, it is like a throat infection, and it starts with children. It can cause a sudden onset. So, cause number four is the cause and the recovery prognosis. Recovery chances are better if OCD started later in life. Like अगर बचपन से OCD है तो फिर there is low chance कि वो cure हो सकता है. But if it started later in life, for example, in early adulthood, so there are chances that it can recover. Or the person has a good insight, और the symptoms जो है वो बहुत ज्यादा intense नहीं है. They are not very very bizarre. So OCD does not have just one cause. It is a mix. It is a mix of biology. It is a mix of personality, life experiences. For example, allergy. Allergies है या फिर diabetes है. It runs in families, but it also depends on your environment. आपका environment भी इसमें एक like factor है, and your family also. Next is culture related diagnostic factor. Yeah. In this section, it explains how culture influences the themes of obsessions and compulsions. So, obsessions reflect cultural belief. OCD symptoms जो होते हैं वो sorry, they mirror your cultural fears and values. Like religious cultures में क्या होता है, उसमें ज्यादातर आपके religious obsessions होते हैं. जैसे कि तो अब जैसे कि हिंदुइज्म में इट इज तुलसी वाली चीज की, शाम को अगर आपने तुलसी की पत्ती तोड़ ली तो फिर पाप हो गया कि आपने भगवान को ऑफेंड कर दिया. So that is a religious obsession. And in cleanliness oriented cultures, more contamination fears कि अच्छा यहाँ पे छूने से germs हो जाएंगे, इसको साफ करो. लाइक हर चीज में डबल डबल ओवर थिंक करना, बार बार सोचना. तो कुछ कल्चर्स में people might worry excessively about not praying perfectly or even stepping on a holy text. Yeah, and more people are worried about order or symmetry. Like अरे ये चीज order में नहीं रखी, इसका color combination गलत है, इसका वो गलत है. तो ये कल्चर से होता है. एंड रिचुअल्स कैन ऑल्सो लुक कल्चरल. कंपल्शंस जो है दे माइट रिजेंबल कल्चरल और रिलीजियस रिचुअल, बट इसको ओसीडी व्हाट मेक्स इट ओसीडी कि कंपल्शंस जो है उसमें कल्चरल और रिलीजियस रिचुअल्स होते हैं, क्योंकि रिचुअल तो कोई भी कर सकता है, तो जरूरी थोड़ी उसको ओसीडी होगा. बट ओसीडी उस बंदे को होता है अगर वो चीज, वो जो रिचुअल्स वो कर रहे हैं दे आर रेपिटेटिव, दे आर एक्सेसिव एंड दे कॉज डिस्ट्रेस. बिकॉज जो रिलीजियस रिचुअल्स होते हैं they are supposed to be peaceful. They should not feel compelled. So if they are feeling compelled, it can be OCD. And diagnosis challenge is a behavior that's normal in one culture might seem OCD like in another. So the clinicians जो diagnose करते हैं उनको जो चीज पूछना चाहिए that is this part of their culture or is it driven by anxiety or distress? OCD होता है, it does not pick one type of fear. It borrows whatever is most important in your culture. It's like your brain जो है वो जो मीनिंगफुल चीजें होती हैं, जो चीजें आपको पसंद होती है, इट गिव्स यू पीस, वो उनको स्केरी ऑब्सेशंस में टर्न कर देता है. तो सेक्स एंड जेंडर रिलेटेड डायग्नोस्टिक इशू, इस पार्ट में we will explore that how OCD might look different in males and females and especially across ages. In children, boys are more likely to develop OCD during childhood. And boys with OCD often have earlier onset. They have sex-related OCD and they have ordering compulsions. Like बच्चों में it's basically that boys जो हैं उनको more likely होता है बचपन में ही that they develop OCD. इसका जो साइंस होंगे वो आर दैट दे कैन बी अर्लियर ऑनसेट, और उनको टूरेट वाला दिक्कत हो सकता है. दे हैव प्रॉब्लम इन स्पीकिंग प्रॉपर्ली, या फिर उनको ऑर्डर वाला कंपल्शन हो सकता है कि ये चीज ऑर्डर में क्यों नहीं है, वो क्यों नहीं है. एंड एडल्ट में women में होता है slightly more likely. Women are more likely to have OCD in adults than men. उनका जो obsession होता है they focus on cleaning, और अगर like उनके loved ones को harm पहुंचे तो बार बार यही चीज सोचना कि अरे अगर उसको एक्सीडेंट हो गया तो इसको हो गया तो वो हो गया तो दे आर obsessing on the same thing. डिफरेंसेस इसमें ये है कि जो मेल्स हैं वो पुअर इनसाइट शो करते हैं एट द टाइम ऑफ डायग्नोसिस. मीनिंग वो ये चीज लाइक बिलीव ही कर लेते हैं कि उनके जो ओसीडी थॉट्स हैं वो हैं और उनको ओसीडी है, बिना डायग्नोस करा हुआ वो बिलीव कर लेते हैं, और फीमेल इतने जल्दी नहीं बिलीव करती है. नाउ ओसीडी इट डज नॉट डिस्क्रिमिनेट बिटवीन मेन एंड वुमेन, बट द वे इट शोज अप वो वेरी कर सकता है कि मेन को टिक्स हो सकते हैं, उनको टूरेट्स हो सकता है, और women को कुछ cleanliness की चिंता हो सकती है या फिर अपने loved ones की harm हो सकती है, but underneath, if you see it, it's the same anxiety cycle repeating and repeating. So the functional consequences is basically how does OCD mess with someone's daily life. It is very, very disruptive. It can drain your time. Obsessions and compulsions, it can take hours every day. Even छोटे से छोटा जैसे कि mild OCD होता है, it can also eat up your time. It can make people late. It can make you distracted और बस वो बहुत थक सकता है बंदा. And second is work and school. अब जैसे कि for example someone checks their mail for missing. कोई किसी ने एक mail लिखा है and they're checking their mail over and over again for mistake and they feel like if they are seeing it एक अब कुछ गलती तो नहीं हो गई, कुछ गलती तो नहीं हो गई एंड फिर वो सबमिट नहीं कर पाते हैं क्योंकि वो बार बार उसे देखते हैं जिससे कि डेडलाइन मिस हो सकती है. यू कैन अवॉइड सर्टेन टास्क. और अगर कुछ लोगों के साथ ऐसा होता है दे हैव टू क्विट देयर स्कूल लाइक इफ द रिचुअल्स दे गेट वेरी वेरी ओवरवेलमिंग फॉर देम दे हैव टू क्विट स्कूल. नेक्स्ट इज होम लाइफ एंड रिलेशनशिप. Family members may be dragged into compulsions like it creates conflict between relationships, resentment, or even burnout. Romantic relationships can also suffer due to secrets or even time loss or guilt or everything. Next is social isolation. People with OCD, they avoid friends, they avoid outings, they avoid public spaces. क्योंकि ट्रिगर्स तो हर जगह है उनको बस दे आर स्कैर्ड कि उनको कब क्या ट्रिगर कर जाएगा दे डोंट नो व्हाट विल ट्रिगर देम so they are afraid कि जो बाकी लोग हैं वो उनका बिहेवियर नोटिस कर लें. Next is an emotional impact. Emotional impact will lead to low self-esteem. It will lead to more anxiety, shame, और उनको लगेगा कि वो पागल है. उनको ऐसा crazy वाला feeling आएगा कि they are very out of control and they are crazy. So OCD can quietly take over someone's life. Like पता भी नहीं चलेगा कब वो बिल्कुल आपकी लाइफ पे टेक ओवर कर पाएगा. फ्रॉम ब्रशिंग देयर टीथ टू आंसरिंग ईमेल. इट्स नॉट कि भाई बंदा ड्रामा कर रहा है बिकॉज इट इज नॉट ड्रामेटिक. एंग्जाइटी से फ्रीडम चाहिए होती है. इट इज नीडिंग फ्रीडम फ्रॉम द एंग्जाइटी दैट यू आर फेसिंग ऑन अ डेली लाइफ. Okay. Yeah. So it is not the same as GAD or which is generalized anxiety disorder. Because generalized anxiety disorder is worrying about real life issues like you're worrying about money or health or school or whatever. And OCD is like if I step on this crack, someone is going to die. So this is a very irrational or bizarre thought. So GAD जो होता है उसमें जो worries होते हैं they feel very realistic कि ठीक है अगर पैसे की चिंता है तो that is realistic, that is a real financial issue. And OCD is thought वो काफी ज्यादा weird लगते हैं, bizarre लगते हैं, like they don't really make any sense. Next is body dysmorphic disorder. Body dysmorphic is basically you're obsessed with a flaw in appearance. That it is not even noticeable, but you are still obsessed with that flaw. And OCD is the obsession is not related to looks. It is not limited to looks. So OCD and BDD they can coexist, but they are separate diagnoses. Next is hoarding disorder. Hoarding disorder is when you have trouble getting rid of stuff due to emotional attachment or fear of loss. You have बहुत सारा सामान. For example, you are going through a breakup and someone gave you lots of gifts. And even after 3 years of breakup, 4 years of breakup, you cannot get rid of that stuff because आपका emotional attachment है या फिर you have a fear of loss. And OCD hoarding is because it is very irrational thought कि अगर मैंने ये पेपर फेंक दिया तो फिर मेरे को श्राप लग जाएगा. So that is very irrational thought. Next is tic disorder. Tic disorder is दे आर टेक फॉर एग्जाम्पल सडन या इनवॉलेंटरी जैसे कि हिचकी होती है. अब एक बंदे को हिचकी आती है बहुत रेयरली आती है बट जिसको टेक डिसऑर्डर होता है उसको आती रहती है बार बार. इट इज देयर इनवॉलेंटरी. यू कैन नॉट कंट्रोल दोज मूवमेंट और दो साउंड्स लाइक यू आर ब्लिंकिंग. बार ब्लिंक कर रहे हो. यू कैन नॉट कंट्रोल देम. ऐसे थ्रोट क्लियर कर रहे हो ऐसे करके. यू कैन नॉट कंट्रोल देम. And OCD is intentional behaviors done due to reduce anxiety. एक आप बार बार ऐसे टैप करो सो यू आर डूइंग दिस क्योंकि आपको एंग्जाइटी हो रही है. फिर टेबल पे पैर हिलाना. सबसे ज्यादा कॉमन इज बच्चों को हम क्लास में देखते हैं स्टूडेंट को भी थी कि वो उनके पैर हिल रहे हैं बार बार तो फिर दैट इज बिकॉज देयर एंग्शियस एंड वो वॉलंटरीली ये चीज कर रहे हैं क्योंकि उनको एंग्जाइटी कम करनी है. Obsessive compulsive disorder. It is a personality obsessive compulsive personality disorder. So OCPD is a personality style. It is rigid. It is very perfectionistic. It is controlling. But इसमें behavior का कोई distress नहीं होता. And जो OCD होता है उसमें पर्सन इज डिस्ट्रेस एंड उनको पता है कि कुछ तो गलत है. ओसीडी इज लाइक आई हेट दिस बट आई कैन नॉट स्टॉप इट, एंड ओसीडी इज लाइक मैं सही हूँ और बाकी सब बेकार है, ऐसे करता. ठीक है, तो अब इसमें to break it into easier terms, just because someone is anxious or perfectionistic, like अगर कोई anxious है तो बहुत ज्यादा perfectionism की तरफ है, इसका मतलब ये नहीं कि उनको OCD है. Different, the difference is कि उनके behavior को क्या drive करता है, whether it causes distress or not. अगर वो चीज डिस्ट्रेस दे रही है बंदे को या फिर वो उसके डेली लाइफ में इंटरफेयर करे, देन इट इज ओसीडी. तो कमोर्बिडिटी इज बेसिकली कि जो अदर मेंटल हेल्थ कंडीशंस होती हैं ओसीडी के अलोंग साइड, वो किस तरीके से लाइक, बिकॉज इट इज सुपर कॉमन कि ओसीडी हमेशा अकेला नहीं होता है. ठीक है, वो बाकी मेंटल हेल्थ कंडीशन के साथ होता है. तो जनरलाइज्ड एंग्जाइटी डिसऑर्डर होता है, पैनिक डिसऑर्डर, सोशल एंग्जाइटी. तो वो ओसीडी के पहले भी आ सकता है, फिर ओसीडी के साथ साथ भी, लाइक यू आर पैनिकिंग एंड देन यू आर वॉशिंग योर हैंड्स, यू आर पैनिकिंग, यू आर वॉशिंग योर हैंड्स. Next is depressive disorder, or major depressive disorder is very, very common with people with OCD. They feel very hopeless, they feel very sad, they feel unmotivated because उनको disorder का stress हो रहा है. उनको OCD भी है, फिर उनको stress भी हो रहा है, फिर उसके बाद they are depressed about the stress of the disorder. So it is very um, complicated. And next is bipolar disorder. कुछ cases में mood disorders होता है, जैसे कि bipolar, they can overlap with OCD. For example, जो clinicians होते हैं, they should know this that people suffer with bipolar disorders along with OCD. Like it is common कुछ cases में. So before giving meditation, treatments उसमें अलग अलग होते हैं. And in tic disorders that बच्चों में और जो teens होते हैं, मोटर टिक्स होती हैं, ऐसे ऐसे बार बार ऐसे ऐसे करना. ठीक है, या फिर ब्लिंकिंग करना, बोटल टिक्स होती है, ये सब करना. तो इट कैन कम विद ओसीडी. बॉडी डिस्मोर्फिया, होर्डिंग, वी said, and trichotillomania and excoriation. Deep में we will study in the next session, but trichotillomania is basically hair pulling, like intentionally you are pulling up your hair, and skin picking is excoriation. आप अपने skin खींच रहे हो. So those like OCD is very rarely alone. It is part of a mental health squad. Like if there is OCD, there can be anxiety, there can be depression, there can be tics, border related issues, and it is a full picture. Like if you're treating it, so a full picture should marry like what is coming along with OCD, because it is not rarely alone. That was all about OCD.